Hello everyone, let's learn today Norma lateralis. Now we know it's a lateral view of the skull. So let's see what are the bones taking part in Norma lateralis. Now this is frontal bone, this is parietal bone, the occipital bone. This portion is squamous part of the temporal bone. This is mastoid part of the temporal bone, portion of styloid process. This is mandible. This is zygomatic bone. This one is maxilla, and still behind you can see nasal bone. So these many bones are visible in Norma lateralis. Let me show you the bones individually. So this one is frontal bone, and this portion is visible in Norma lateralis. If I connect it with the parietal bone, see, these are the parietal bones. They are connected in the midline forming sagittal suture, and over here will be the coronal suture where these two bones, frontal and parietal bone, they will join together. See this, now the frontal bone is joined with the parietal bones. Now over here this will be the lambdoid suture, so here will be the squamous part of the occipital bone. Let me join it. So this is occipital bone. This is the squamous part of the occipital bone, and if I connect this portion with the parietal bone like this, see, it is joined now. So this is the lambdoid suture where this squamous occipital is joined with the parietal bone. This will be the formation of the part of the coronal suture. So here this is the frontal bone. Now this gap is filled by the temporal bone. Let me join it. So this is temporal bone. This is squamous part of the temporal bone. This portion is external acoustic meatus. This is mastoid part of the temporal bone, and this is its zygomatic arch, part of the zygomatic arch. So let me join these together. Here it is. See, now it is joined. So this is temporal bone with mastoid part. This is occipital bone, parietal bone, frontal bone. Now in the front of temporal bone, the gap over here will be filled by the sphenoid. Let me join it. So this is sphenoid, and in the center this is the body. The upper portion is the lacer wing, and this is the greater wing. So the greater wing will be found over here in the Norma lateralis. Let me join it. See, now it is joined. So this is frontal bone, greater wing of sphenoid, the squamous part of the temporal bone, and parietal bone. These four bones are fused together, and over here at their meeting point, this portion is termed as asterion. So now all these four bones are fused together. In front of sphenoid will be the zygomatic bone. Let me join it. So this is zygomatic bone. This is its frontal process, and this is its temporal process. So this is temporal bone, this is its zygomatic process. So zygomatic process of temporal bone will fuse with the temporal process of zygomatic bone like this. And this is frontal process of zygomatic bone. It will fuse with this zygomatic process of frontal bone like this. So now you can have an idea of almost Norma lateralis. What is needed is to put the mandible over here. Let me join it. See, here comes the mandible. In front of zygomatic bone over here will be maxilla. Let me join it. Now this is maxilla. This is its alveolar process. This is frontal process, and this one is the zygomatic process. So this zygomatic process of maxilla will fuse with the zygomatic bone over here. Let me join it. And the frontal process will fuse with the frontal bone over here in front. See this. So this is how the Norma lateralis is formed. Now let's see the bony landmarks. Now this is the zygomatic process of frontal bone, and this is frontozygomatic suture. Just about to it, one temporal line starts, and that will run upward and backward like this. When it reaches to the coronal suture, it will divide into two superior temporal lines and inferior temporal line. Now superior temporal line will arch backward and it will fade away, and the portion of superior temporal line is also visible in Norma verticalis. The superior temporal line will provide attachment to the gallia aponeurotica and temporal fascia, whereas the inferior temporal line, it runs below and parallel to the superior temporal line, and then it will run forward and downward, and it will reach towards the external acoustic meatus, where it turns into a crest, and that crest is termed as suprameatal crest, as the crest is oriented posterior-superior to the external acoustic meatus. That is termed as suprameatal crest. So this is how the inferior temporal line is a continuous line. Now what happens to the suprameatal crest? It will be continuous as posterior root of zygomatic arch. This is zygomatic arch. It has got posterior root and anterior root. So the suprameatal crest will continuous with posterior root of zygomatic arch, and which will further continuous as upper border of zygomatic arch. This is the zygomatic arch, which is formed by zygomatic process of the temporal bone, and it is completed from in front by temporal process of zygomatic bone. The suture between these two you can see here. Now the zygomatic arch, or it is also called as zygoma, which is approximately 3 to 4 cm long, and as I mentioned, it is formed by fusion of two processes. From in front, the temporal process of zygomatic bone, and from behind, zygomatic process of temporal bone. It has got outer surface, which is subcutaneous. It has got inner surface, which is providing attachment to masseter muscle. It has got upper border. The anteriormost part of the upper border is termed as jugal point. Posteriorly, the upper border is continuous as posterior root of zygomatic arch. This is posterior root, and which is further continuous as suprameatal crest. That is what we have discussed. The lower border, it provides attachment to masseter muscle, and it is continuous as anterior root of zygomatic arch. So this is anterior root, this is posterior root. The upper border also provides attachment to temporal fascia. Now between the anterior root and posterior root, over here you can see there forms a tubercle. That is termed as articular tubercle, and that itself is providing attachment to lateral ligament of jaw joint or lateral ligament of temporomandibular joint. So this temporal fossa, below it is connected or in communication with infratemporal fossa, which will be situated over here, and there will be a formation of gap between zygomatic arch and this temporal fossa, through which there passes tendon of temporalis muscle, deep temporal nerve, and vessels. Now let's see external acoustic meatus. This meatus is formed by two bones, tympanic plate and the squamous part of the temporal bone. Now let me show you the same in separate bone. So this is temporal bone, and over here you can see this is external acoustic meatus. This is tympanic plate, which is triangular in shape, and that contributes anterior boundary, floor and lower part of posterior boundary of external acoustic meatus. The remaining boundary is formed by squamous part of the temporal bone. So this is external acoustic meatus. The outermost margin provides attachment to the cartilage, auricular cartilage, and the center point of this meatus, it is called as auricular point. through which there passes Reed's baseline. Now another important thing related to external acoustic meatus is on its postero-superior aspect. Over here there is a formation of triangle. Now that triangle is called as suprameatal triangle or Mac-Evans triangle. Anteriorly it is bounded by this suprameatal crest, which is a continuation of inferior temporal line. Antero-inferiorly over here it is formed by postero-superior boundary of external acoustic meatus over here. And posteriorly you will have to imagine a tangent which touches both the suprameatal crest and the postero-superior margin of external acoustic meatus, like this. So here there is a formation of triangle. This is termed as suprameatal triangle or Mac-Evans triangle. The clinical significance of the Mac-Evans triangle is approximately 12 to 15 millimeters deep to it there runs mastoid antrum or tympanic antrum. Now at the time of birth the thickness of this bone is around only 1 millimeter, and thereafter it increases in its thickness at the rate of approximately 1 millimeter per year, and maximum it becomes 12 to 15 millimeters. So it grows up to 12 to 15 years to obtain its adult thickness. Now antero-inferior to this triangle, sometimes you may find a bony spine. Over here you can see, let me bring it closer. There is a bony spicule at antero-inferior part of this triangle. This is termed as suprameatal spine. So that is about Mac-Evans triangle. Now posterior to that there is mastoid part of the temporal bone, and still posteriorly it is connected to the parietal bone by parieto-mastoid suture, you can see over here, and another bone it is connected with is the occipital bone, squamous part of the occipital bone. So here there is formation of occipito-mastoid suture. This is parieto-mastoid suture, and both this suture will meet at lambdoid suture over here. This meeting point of three suture is termed as ASTERION. Now this is a site of posterolateral fontanelle which gets fused at the age of 1 year. Now along the course of occipito-mastoid suture or nearer to it there is a foramen which is generally in the mastoid temporal, so it is termed as mastoid foramen, and deep inside it opens into sigmoid sulcus. So that foramen will allow passage of an emissary vein which connects the posterior auricular vein with the sigmoid sulcus. In addition to that, mastoid foramen will allow passage of the meningeal branch of occipital artery. Now this mastoid temporal bone below it gives a bony projection. This bony projection is called as mastoid process, which develops at the age of 2 years. Now this is its lateral surface, and this provides attachment to three muscles from before backward, namely sternocleidomastoid, splenius capitis and longissimus capitis. So you can remember a mnemonic for that: S, S and L. First S is for sternocleidomastoid, second S is for splenius capitis, and third L, right, third letter is L, which is for the longissimus capitis. Now if you turn it down, there runs a notch deep to the mastoid process, and this notch is providing attachment to posterior belly of digastric. Next to the notch there is a groove, and this groove is lodged by occipital artery. Now deep to mastoid process there is a styloid process, which is again a part and parcel of temporal bone. It is a bony spicule and that runs downward, forward and medially. This provides attachment to two ligaments, stylomandibular and stylohyoid, and three muscles: stylohyoid, which gets attached to the hyoid bone, styloglossus, which goes inside the tongue, and stylopharyngeus, which is a part of pharyngeal wall. So 2 ligaments, 3 muscles and styloid process itself. Together it is termed as styloid apparatus. Between styloid process and mastoid process there is a foramen, you can see over here, and that is termed as stylomastoid foramen, which allows passage of facial nerve. Now as I mentioned, mastoid process develops at the age of 2 years. So before that there is no mastoid process and the facial nerve is exposed to the surface. So during birth there are chances of facial nerve injury. Now over here, previously we have discussed that there is a fusion of 4 bones. From over here, greater wing of sphenoid, the frontal bone, parietal bone and squamous temporal bone. These 4 fuse together in the form of an H-shaped suture. This point is called as, or meeting point is called as terion. Now the terion has got a clinical significance. The position of terion is approximately 4 cm above the midpoint of zygomatic arch, or it is situated approximately 3.5 cm behind the frontozygomatic suture. So here we'll get terion, and deep inside terion there runs 3 important structures. The first is middle meningeal vein, second is anterior division of middle meningeal artery, and third is stem of lateral sulcus, or it is also called as Sylvian point. So these 3 structures or 3 important structures are found deep to it. Now this terion is used for trephining this portion by neurosurgeons to relieve the raised intracranial pressure secondary to extradural hematoma. So that is the clinical significance of terion. Now this portion is the temporal fossa. It is bounded above by temporal lines, in front by posterior surface of the zygomatic bone, part of frontal bone, part of sphenoid. Below it is connected or in communication with infratemporal fossa, and in the floor there is formation of terion. All around the temporal fossa provides attachment to temporalis muscle, which is limited up to inferior temporal line. Now the tendon of temporalis will fill the gap deep to the zygomatic arch, and finally it gets attached to the coronoid process of mandible. Let me show you this. This is mandible, this is body, this is ramus, and it has got 2 processes, coronoid and condyloid process. So this is coronoid process which receives insertion of temporalis muscle. So if I connect it like this, deep inside you can see coronoid process, and that receives insertion of temporalis. Now deep to the ramus of mandible, this will be the territory of infratemporal fossa. Above it is in connection with the temporal fossa, and anteriorly it is limited by posterior surface of maxilla. Medially it is limited by lateral pterygoid plate. Floor and posterior wall are open, and for detailed description please watch my separate video regarding infratemporal fossa. Now between lateral pterygoid plate and the maxilla there is a formation of fissure. Over here you can see this is termed as pterygomaxillary fissure, and through this fissure the infratemporal fossa, which is lying over here, it is in communication with the pterygopalatine fossa. Again, for detailed description of pterygopalatine fossa please watch my separate video. So that is about Norma lateralis and its bony features. Hope you understood well. Thanks for watching.